ADHD Awareness Month. ADHD, one of the most common neurodevelopmental disorders of childhood.
Today we're checking in with Dr. Laura Saunders to learn more about some of the signs and symptoms to better understand the disorder. Good morning, Doc. How are you?
Hello, friends. Happy Thursday. And yes, October is National ADHD Awareness Month. And there's so many people these days that feel like they have ADHD, adults even, but it actually is a common neurodevelopmental disorder of childhood. So even if you think you have it in adulthood, the symptoms need to be traced back to childhood.
And you say that, some people in adulthood can be diagnosed, again, later in life.
Yes, the symptoms as you go along a developmental trajectory kind of look a little different and take shape differently in adulthood, but it is typically considered a childhood disorder, so you do need to trace back the symptoms to childhood.
Okay.
Dr. Saunders, obviously you just mentioned this is a childhood-based disorder, basically, so you probably have it. Maybe you're born with it. I'm not sure. But what are the signs that we should be looking out for? Because it does take, it sounds like quite a bit of time and extensive, like you said, documentation to actually diagnose.
Yes, that's a great question, Caitlin. So, I mean, there's some really common symptoms. It's inattention, impulsivity, right? We all know those young people that have no impulse control and just are darting and doing all these different things without any thought to kind of slowing down their impulses. They're easily distracted and a lot of motoric restlessness. And I'm not talking about young children are somewhat restless and active, but we're talking about individuals that are outside the bounds of what would be considered typical.
Behavioral therapy or medication, what do we do?
I think we always start with therapeutic interventions. Honestly, one of the most common therapeutic interventions is parent training, because parenting these kids is a little bit different. So we're going to work really heavily with the parents on understanding their child's unique needs. So we start with therapy first. There's lots of different strategies and accommodations that can happen in school. And then from there, later on, if those interventions are not working, then we look at medication.
Dr. Saunders, you just mentioned school. Is that a spot where teachers, administrators, maybe healthcare officials within the school system, are they looking out for some of these things too with students?
They are always looking out for these kinds of things. And again, what I love about teachers is that they have such a great understanding of typical development, because they see, year after year, they see groups of children. So teachers are good about saying, yes, this child's behavior does seem to be outside the bounds of what would be typical for other kids this age. They can't necessarily identify it on their own, but generally I encourage parents to check in with their teachers or their school administration officials to really understand how their child's performing in school and how they look compared to their same age peers.
You may not have the answer to this, but do you know what percentage of kids are diagnosed with ADHD?
I actually don't know the percentage off the top of my head. I know that the numbers have increased. And again, those increasing numbers have to do with changes to the diagnostic criteria and actually looking at it as along a spectrum as well. I mean, there are kids who have kind of low-level deficits in attention and concentration and impulse control. But again, that changes as they get older. The other thing to note is that girls are often underdiagnosed. They tend to have more of the attention deficit without the hyperactivity, and they have difficulties as it gets into middle school and high school. They don't have as much of the motoric component.
Interesting.
So this is very interesting, and there's a lot that kind of gets caught up in the weeds a little bit with some of this. Like you said, girls maybe a little bit more underdiagnosed. It seems like there's more diagnosis in general now than there was even 20, 30 years ago. We'll have to have you come back in another week to continue to dive into some of this, because there's so much information, Dr. Saunders.
Yeah, I'd love to do that. Thank you.
All right. Medication for adults, real quick before you go.
Medication can be really helpful. So, the medication is a stimulant medication, but it actually works kind of the opposite of the way you think in the brain. It doesn't make them hyper. It actually makes them more focused and able to pay attention.
All right. Thanks, doctor. Always good to see you. We'll see you again next week.
Have a great day.
You too.